Welcome to another Doc Smo video. I'm your host, Dr. Paul Smolin, a board-certified pediatrician with 34 years of practice experience. So you're coming home from the hospital with your brand new baby and you're a little bit tired. No, you're actually exhausted. That's because everyone in the hospital wants you to deal with them on their terms. They're always waking you up. The telephone's ringing, your friends are coming by. Hospitals are good places to get medical care, but not really good place to get a lot of sleep and rest. But finally, you're home, in your bed, in your house, and you're really planning on some power sleep. And you're thinking, my baby was so good in the hospital. She was really quiet, didn't demand very much. I have the best baby ever born. And of course, you're hoping that maybe that quiet bliss will continue. So now it's decision time. You've got to decide if you're going to let your baby set their own feeding schedule, just wake up and tell you when they need to feed, or whether you need to set a schedule for your baby. So I thought it would be interesting to discuss that issue today and give you my perspective. Now remember, we're talking about only the first week of life here, and we are trying to decide, should babies set their own schedule or should we set a schedule for them in the first week of life? They know when they're hungry, right? They should wake up and feed. Let's back up and look at life from your baby's perspective in the womb. Your baby is fed continuously. They are never hungry or thirsty. Prior to birth, your baby has never experienced hunger or thirst and may not know what to do with these feelings when they encounter them. In the womb, there are no responsibilities. Life is good, Mom. I can't mess up. I don't have to do anything. They just take care of everything for me. But now your baby is born, and after that long, strenuous process, and they are exhausted. If your baby could talk in the first 2 days of life, they would probably say something like, "Wow, I have a headache, and I am so tired. Just leave me alone. I just want things to be quiet and for you guys to stop undressing me. I hate that. And while you're at it, turn down those lights and tell Junior in the crib next to me to stop crying. And that whole sucking thing, I suck and suck, but only get a few drops of milk. Sucking is fun, but not very rewarding. Well, no mind. I'm not very hungry anyway, since I was born with plenty of extra water in my body." But now your baby is 3 to 4 days old, and his or her thinking has totally changed. They're now thinking something is not right here. I have this uncomfortable feeling. I'm hungry and I'm thirsty, and I've never been like that before. Well, as they say around North Carolina, it's time for your baby to fish or cut bait. Time to separate the men from the boys, the divas from the wallflowers. Your baby needs to take some action. Now, most babies, by 3 to 4 days of age, are starting to get really thirsty and really hungry and don't like that feeling, and they will scream and scream and scream and demand to be fed. They figure out quickly that feeling means screaming and screaming. That means mom comes, and when mom comes, it means the feeling goes away. But not all babies get it. Some of them are really sleepy and exhausted from the delivery process, and they simply do not respond to these feelings of hunger and thirst. They just keep sleeping. They remain dopey and sleepy and lethargic like most babies were in the first 2 days of life. Well, these sleepy babies can get into real serious trouble with both dehydration, since they're getting very little fluid in, and jaundice, since milk is not going through their intestines. Their poop has no bile in it, and the bile that they do get out of their liver backs up into their blood. That is what we call newborn jaundice. These sleepy babies, have already used up their reserve of water, their tanks are running on empty, and they're not refilling their tanks. They can become progressively weaker and less demanding. And these sleepy babies, parents are thinking, everything's okay. Since Junior isn't demanding to be fed, I guess everything is good. But in reality, their babies are heading for trouble. You may be thinking at this point, how do I know if I have one of those sleepy babies Doc Smo is talking about? Or just a really great newborn that likes to sleep? Well, here are some signs that your baby may be getting into trouble. Sign number 1, you don't see wet diapers coming every 4 to 6 hours, and especially if your baby's urine has some orangey red chalky looking material in the diaper. This may mean that your baby is dehydrated, and that dehydration can make them even weaker and less likely to demand a feeding. Sign number 2, your baby is getting more yellow on the 3rd or 4th day of life. We call that jaundice, bile backing up in the blood. And bile in large quantities in the bloodstream of a newborn can make them very sleepy. Again, reducing the chance that they're going to scream and yell to be fed, which is what they need to do to solve their problem. Sign number 3 is that their poop hasn't changed colors from the black sticky poop they had in the first few days of life to a yellow or a green or a brown color by the 4th day of life. We like to see that color change because it means that milk is making it through your baby's gut. And the final sign, your baby's weight has dropped more than 10% of their birth weight. This is something your pediatrician is really on the lookout for because this is usually a clear sign that there is trouble. So you're probably wondering what my recommendations are about feeding schedules for newborns in the first week of life, right? Well, I'll tell you. I think you should wake your baby up every 3 hours during that first week of life to make sure they are not one of these sleepy babies. And by every 3 hours, I mean every 3 hours. From the beginning of one feeding to the beginning of the next, there should be no more than 3 hours, which means that you're really feeding them every 2 hours. And try and get your baby checked by your pediatrician or family doctor as close to the 4th day of life as possible. That's the time when babies who are getting into trouble have a difficult time. And make a mental note, if your baby is born on a Thursday, then their 4th day of life will be Sunday, and that's an extra dangerous day for babies because a lot of doctors' offices are closed on Sunday. Sunday or no Sunday, your baby is going to need to be checked on the 4th day of life if you're not seeing that golden poop and lots of pee-pee and they're not waking up to be fed. And if you have a preemie, that's an infant born at less than 37 weeks, be extra careful. Preemies have trouble with the simplest things. Sometimes they just don't wake up, they just don't pay attention, they're just acting like preemies. And look at those wet diapers every 4 to 6 hours. Lack of urine output should alarm you. And that poop, it should be golden by the 4th day of life. So the bottom line, the take-home message today is lack of stool and lack of urine in a sleepy baby who's difficult to feed could mean trouble in the first week of life. Wake them up every 2 to 3 hours for that first week to make sure that they feed enough. Well, thanks for joining me today. Please don't hesitate to call that wonderful person you call your pediatrician for help if you think you have one of these sleepy babies or you have any other concern about your new baby. Until next time.